Good day to our viewing audience. We are joined here today yet again with Dr. Frank Anthony, the Minister of Health. Good morning, Minister. As we begin our COVID 19 update for this morning, can you tell us what is the current hospitalization status and active cases?
As of yesterday, we have right now 28 persons in hospitals across Guyana, with 21 of those persons being in the Ocean View Hospital. Of the 21 that we have at the Ocean View Hospital, 5 of those persons are in the ICU. We currently have 741 cases that are active across the country, with 32 new cases over the last 24 hours. And of the 741 cases that we currently have, 386 of those cases are in Region 4, with 162 being in Region 6. We also have 85 cases in Region 3 and 29 cases in Region 10.
We spoke just a while ago about Region 10, um, with a very significantly low number of vaccination. And we've seen Region 2 and Region 8 as well kind of follow suit in that regard. What are the health systems that are currently in place to attempt to raise those numbers in terms of vaccination?
Well, a lot of this it has to do with people's behavior and people taking personal responsibility. I think as a government, as an institution, we have put the mechanism in place to allow easy access to vaccines. Um, we have several testing sites, they're available to people. Initially, we had these at the street corners and so forth, but people weren't coming forward. We continue to provide adequate testing sites. We continue encouraging people. We have a number of campaigns. We have been working with the DJs in Linden to get the message across. We have been speaking with religious leaders, political leaders, community leaders, and this here is a community effort. It's without each one encouraging the other to be vaccinated, it's going to be a difficult task. As we know, there's a new variant that has emerged. It's called Omicron. It's spreading rapidly around the world. It's in more than 89 countries right now, and it is going to continue to spread because it's highly transmissible. What the scientists have determined is that if you've had your second dose shot 6 months ago, then your immunity would have weaned, and therefore you would have less protection against Omicron. So they're advising that people get their booster shot, and we have started giving booster shots about 3 weeks ago. And again, there are lots of people who are eligible for booster shots, and if they want to protect themselves, they should really go and get that booster shot. Going forward in 2022, of course, we still have to prepare for COVID-19, and we would have to make allocations to continue our vaccination program. This would include both the procurement of vaccines and the rollout of the program to different parts of the country. So we'll have to budget adequate resources to do so. In addition to that, transporting the vaccines from point A to point B require a cold chain, and if that cold chain is broken, then the vaccines would not be viable. So we'll have to take those precautions. We'll have to budget monies to do that. So I expect that in next year's budget, we'll have adequate amounts of money for both doing the diagnostics, the testing for COVID, if people get sick, to be able to provide proper care for them, and of course in terms of prevention, to make sure that we are able to do the vaccination and other measures that are necessary.
This has been our COVID-19 update for today, December 23, 2021. For more information, visit our website at dpi.gov.gy or any of our social media platforms. For DPI, I am Shakwan Bill.